one thing that you need to understand about the spleen meridian is that the points below the knee, so we'll say from spleen 3 to spleen 9, these are on the deep front line, whereas the points spleen 10 to spleen 12, these are on the superficial front line, and they will affect that fascial line. This is an important distinction, and it actually explains a lot about the way that we use points and some of the contraindications. For instance, spleen 6 is contraindicated in pregnancy, but spleen 10 isn't contraindicated in pregnancy. Now, why is that? That's a big question. And spleen 6 is on the deep front line, and it actually gets into the deep pelvic fascia. And I believe this is the reason why that point's contraindicated in pregnancy, whereas a point like spleen 10 that moves the blood is not necessarily contraindicated in pregnancy. Let's see, the other thing that this page reads is that points like stomach 36 and stomach 40 are also used for lung and heart patterns, stomach 36 for qi and yang deficiency patterns, and stomach 40 for phlegm patterns. And this is a very important topic that we're going to go into in greater detail as we learn more about the superficial front line and some of the master Tung points that are on this line. And they're actually very similar to points you're already using, like stomach 36 and stomach 37. And we're going to look at that in just a moment. Let's take a look at the next page that reads regions and bands on the superficial front line. So the first thing that I want to do here is distinguish between some of the different areas of the stomach meridian. So the thigh band runs from the ASIS to stomach 34, and then below the knee we have the leg band from stomach 35 to stomach 41. And then we've got the region of the foot, and I've written stomach and gallbladder meridians between the metatarsals. So we know that, but what I want to do is just distinguish between these three areas right now, between the thigh and the leg and the foot regions. And certainly there's some overlap with the way that we use the points being on the stomach meridian, but there's also some distinct differences as well. And typically in TCM, we don't often needle stomach points that are on the thigh. But in the Master Tung system, there's a group of 3 points on the stomach meridian that are on the thigh that are used for respiratory conditions. And we're going to dig into these point groups and compare and contrast them with TCM style point prescriptions. So for now, I just want to mention and draw your attention to that, because that's one distinct difference in the way that we use points on this line in the Tung system. Now, I've also written, you'll see the spleen meridian here, and the points spleen 10 through spleen 12 are also located on the superficial front line. And it looks like from the picture that the point spleen 9 down to spleen 6 would also be on the superficial front line, but that is not the case. The spleen points that are on the leg are on the deep front line, and we'll look at that fascial line in a different section. Now, just continuing to read along here, it says abdomen and chest points use in later stages of treatment if non-local points don't produce satisfactory results or if the patient reaches a plateau. So in TCM style point prescriptions, if someone has abdominal pain, it's not uncommon that you would use points like stomach 25 or Ren 12 or Ren 6 or possibly Ren 4, some local points. But we don't do that in the Tung style. We do the more distal points. Now, in TCM, we would also likely use a point like stomach 36 for abdominal complaints. But in the Tung system, we'll do the Daomos, where we use a group of 3 points on the leg in close proximity to each other. So the way that this overlaps with TCM is that in some of the TCM point protocols, we do find points like stomach 36 and stomach 37 being used together, but they may also be combined with points on the abdomen, such as stomach 25 or Ren 6 or Ren 12, which we see are also on the superficial front line. So in some sense, if you're doing a point prescription like stomach 25 and stomach 36 and stomach 37, then you are doing a Dalma, but that third point being stomach 25 would not be located on the leg then. What appears to be more useful clinically is to needle on the leg 3 points in close proximity when you're treating the stomach meridian. And in the Tung style, we don't typically needle points on the abdomen. There's certainly sometimes there are, and there is a point prescription for that if you want to do abdominal points, but typically we're doing non-local needling. And I'm a big fan of it because it works a lot faster than doing local needling, and it's less invasive and less dangerous when you're not needling on the torso. So for these reasons, I prefer to do non-local needling. Now, one method, I may have mentioned it earlier, and I'll likely refer to it a number of times through this course, is that a good treatment strategy for all types of conditions is to start with the more distal points and then move your way more proximally. Now, this is a general statement, but because we use points like stomach 36 and stomach 37 so frequently, or like stomach 44, for example, these are all distal points, and they're distal to this thigh band that runs from the ASIS to stomach 34. And I think this is probably one reason why these points on the stomach meridian in particular are used more often than the points on the thigh for treating digestive related conditions, is because the points on the leg and the feet are producing a stronger response. Now, for certain things, it is preferable to use points on the thigh, and to some degree in TCM, we do use points like spleen 10 and other points on the thigh, but they tend to be used less frequently than points on the legs and on the feet. And I think that this is probably because, generally speaking, the distal points tend to produce stronger and quicker results.